Hello, everyone, and welcome back to the Best on Wellbeing podcast. My name is Guillaume Tremblay, and today we continue our discussion about physical health, but I want to look at it from a little bit of a different angle in terms of how do we relate to our body when there's a problem, when there's a pain in a certain joint, for example, or a part of our body, say our stomach, that's not working well. So this episode is more about looking at kind of that chronic issue. Chronic mean it's been happening for at least a couple weeks to months or years. These sort of persistent problems that we are experiencing with our physical body. And in this instance, over the years, when I've worked with a lot of people with chronic health issues, and what I'm about to share, most people often find a little bit silly, but I believe it is a very important aspect to healing. It's a bit of a gentle dance in finding the right balance between recognizing that our body does respond to our emotions, our so-called energy, and at the same time not going too far with these concepts to become kind of a little woo-woo and disassociate from kind of the scientific process. So at the same time, the scientific process can get a little too materialist where it's just all a bunch of chemicals bouncing around, and we just got to find the right chemical balance, and then everything's going to be fine. Where it's somewhere, it's still a mystery how we heal ourselves. And as a clinician, obviously my own ego, my own sense of worth wants to be the guy who's going to fix somebody else. I certainly struggle with trying to not get too far into that kind of mentality. So I love to see people get better, and that's a big part of it. But at the same time, deep down, I know that ultimately I'm there as an assistant. I'm there as sort of the first mate of the boat, and the captain is the patient or the person I'm working with, and they're leading the way. And my job is to be helpful, but not take over the reins of the healing process. And so ultimately, like we said in a previous episode, healing and improving our physical health will come from within, will come from ourselves. So what I'm getting at here is that our body has also has its own kind of emotional sense. What I mean by that is when we have a problem, I'm going to use the stomach for example. Let's say we have this ongoing kind of chronic problem with our stomach. We're always always bloated or having a lot of issue with our bowels, sort of irritable bowel syndrome, things like that. It's very easy to become frustrated with that part of our body. And I've dealt with people that had pretty significant stomach issues. And, I talked to them. I'm like, how do you feel about your stomach? And I remember this one particular gentleman said, I hate my stomach. I hate it. And I was just like, kind of like taken back by, wow, how much that must be impacting to a certain degree his physical symptoms as well. And so, the people that have considered my recommendation over the years, there seems to be something that does happen that's positive. And the point is that it's important to treat each part of your body, particularly the parts of your body that are having trouble, as though it's its own little person. And to be very nice to it and learn to talk to your body. So again, going back to the example of the stomach, when there's a stomach issue, it's okay to just be like talking to your stomach, being thankful to it. Hello, stomach, are you okay? It seems like you're having a bit of trouble these days. Thank you for all you do, all the digestion you give me every single day, all the hard work you do 24/7. I really appreciate you. What do you need? Like, what is it that might be helpful to you? And being quiet with that kind of concept, sometimes it gives an intuition of maybe something that we haven't tried yet. Because sometimes I've been with people, with patients that I've been working with for many months, sometimes years, on a same issue, and we've tried this, we've tried medication, we've tried vitamins, we've tried so many different things and we're not getting better results, and we've seen the specialist, and we've done everything that we can do in terms of what modern medicine has to offer, or even naturopathic medicine, and we're not getting anywhere forward. And this is where I think it's important for them to begin to really have a relationship with that part of their body, to talk to that person, to that part of their body like it's a person, and be very nice to them. And sometimes an intuition can come that like, oh, maybe, I'm going to try to cut out that food. Like you just have a certain sense like that part of your body's talking back to you a little bit and giving you a sense of where to take this in terms of getting better. I've personally had that, with different joints. So, like, I've had some issues with certain joints over the years, and even like at one point, I had a heart thing going on, and I find I've always tried to go into that of just relating to it and being thankful to that part of our body, because it's very easy when we have a problem with that part of our body to be frustrated with it, to be angry, to be resentful towards that part of the body. And I think that has an impact on our ability to improve our physical health. And just from a scientific perspective, there's some evidence, quite a bit of evidence, that positive self talk has an impact on what's called the parasympathetic nervous system. That's the nervous system that's activated when we sleep, when we digest properly, when we recover properly. So it's important for that part of our nervous system to come up, and the sympathetic nervous system, that kind of fight or flight part of our nervous system, to come down and kind of go offline while the parasympathetic nervous system comes online. So, but to really talk to our body, again, some people might find it almost silly, but there is a power to it, that if there's some part of our body that's not quite functioning, or there's causing us pain or issues, to notice any kind of frustration we have with it, and to try to begin speaking to that part of our body nicely. Kind of like we discussed earlier with self-compassion, to learn to be nice to ourselves, to be gentle with ourselves, to talk with a kind voice to ourselves. We want to do that with the part of our body that's problematic, and do it like they have emotions, like it's a child that has not emotions like every other human. It's its own little person, and we got to be really nice to it and thank it. Because, like, again, if you have trouble with your stomach and you're upset with your stomach, okay, but your stomach is working 24/7. Your stomach works really hard, and to recognize that and be thankful for that and send positive energy to that. And then sometimes being quiet with that, we can sort of start to get some intuitions on where to take this. And it doesn't mean we should still get advice from our physician, nurse practitioner, naturopathic doctor, whoever's guiding us in our health. It's still good to have. But I had this idea. Maybe I was going to try this, or maybe we can stop that medicine or start this new medicine. But there seems to be something that can happen when we repeat this practice of being nice to our body, being gentle, treating it like it has emotions. And we can be guided in terms of what to do next in terms of improving the physical health. And if anything, if it doesn't even do anything, there's no intuition, just the act of positive self-talk will stimulate the parasympathetic nervous system, which in general we know scientifically is good for healing and repair. So the point of today is, your body parts have emotions. Make sure to be nice to them. Thank you, folks. We'll see you next time.